Why don't we go ahead and get started? Again, I'm Leslie McDonald, Executive Director of Nonprofit Montgomery, and welcome to our weekly Zoom meeting with nonprofits and county and community leaders, trying to bring you, the latest information about what's going on in the current situation. We're really pleased to have a great panel of guests today, and I want to go ahead and get started, reminding you, of course, to please do put your questions in the Q&A box. For those of you who don't know Nonprofit Montgomery, we're an alliance of nonprofits that serve the county. We do capacity building in the sector, we develop nonprofit leaders, and we do advocacy on behalf of nonprofits. Let me just run down the agenda before I turn it over to our first speaker. We are going to welcome U.S. Senator Chris Van Hollen to give us an update from the big picture perspective at the federal level. We'll have some time for Q&A with Senator Van Hollen, so please do put your questions in the Q&A box. Following that, JoAnn Barnes, the Division Chief from Youth and Families from DHHS, will be offering some information about the new program providing assistance to individuals in Montgomery County. We'll also have Jerome Fletcher to talk about the Public Health Emergency Grant and give us an update on how that's going. In addition, following that, Maryland State Senator Cheryl Kagan is with us this morning to talk about what's going on at the state level. So welcome. We'll have a brief update on funding opportunities with Franca Brilliant. And then last but not least, an important sector update with Shané, Tate, and Newman talking about what's going on with youth, and particularly youth that may not be connected to school at this time. So we're looking forward to that update. So let's dive right in. Welcome, Senator Chris Van Hollen. We're so pleased that you could join us this morning. I can't even follow what's going on at the federal level. There's so much news every day. So please let us know what's going on and give us your perspectives. Thanks for being here.
Well, thank you. And thank you, Leslie, and your team at Nonprofit Montgomery for convening us today, but more importantly for what you do throughout the year and especially during this emergency period. And it's great to be on with you and the others that you just introduced. And I will say that we've been working as Team Maryland at the federal level. Senator Cardin and I and the House members have been working closely together. We've been in regular communication with both the governor and members of the state legislature. I'm really glad you have Senator Cheryl Kagan on with you. And we've been in regular communication with County Executive Elrich and our council members, and glad that you have members of that team on here as well today, because we obviously have to work together to weather the storm and come out on the other side. So let me just thank all the folks who are tuning in, who work for nonprofits, because you have really a vital function to play during this period of time. So many of you are involved in helping provide basic services to people who are most in need in our community. And you're also very important employers. Sometimes people overlook the fact that we have so many employers and people working in the nonprofit sector in Maryland, but you play a vital role within our economy as well. So I just want to talk about a couple of things that have been passed at the federal level, and then of course take any questions regarding hope for next steps at the federal level. The good news has been during this period of time, we have on a bipartisan basis passed 4 pieces of significant legislation aimed first at the healthcare crisis we face, to try to make sure that we can bend the curve and come over on the other side. And that requires providing testing and PPE, personal protective equipment. I will say that we've been incredibly frustrated that those have been in very short supply. That's not a lack of dollars. That's been really a lack of a national supply chain and national productive capacity, not capacity, productive output, which is why we've been pushing the White House so hard to fully implement the Defense Production Act so that we can get those swabs and testing kits and reagents and really build the testing capacity we need to safely reopen. And then, of course, health resources to go to the front lines, whether they're community health centers or hospitals or nursing homes to treat the patients. So that's the healthcare battle. And then, of course, we're all experiencing the economic fallout and pain that's been caused by taking necessary social distancing precautions. And I'm just going to click through some of the things we've done, and again, happy to answer any questions. So the Paycheck Protection Program has, of course, been in the news a lot. There have been lots of issues with the implementation of that program, some with the design of the program. I will say I put forward a very different alternative early on, but we have to work right now with what we have. And the good news from the beginning is that while there was originally opposition to including nonprofits in that program, we were, of course, successful in doing that. And then in this most recent round, we tried to make sure that at least $60 billion from the PPP program would flow through community lenders, because there are lots of small businesses and lots of nonprofits that don't have major established relationships with big banks. And it was pretty clear that a lot of the funds, at least initially, were flowing to people who had those pre-established relationships with big banks. So there's a huge backlog in this program. I understand the frustration, and we need to make sure the monies are going where they're needed most, rather than some national chain. So we look forward to working with you through that program. There's also the emergency loan program, and I'm happy to address any issues with that. That's also been under a lot of strain. I do want to mention a couple of things that have not been focused on as much in sort of the national conversation that are available to nonprofits as employers. One is the deferral of payroll taxes this year. That was designed, of course, to relieve your budgets. Those payments will be due over a period of time starting next year. There's also a provision, if you do not opt into the PPP program, you can still get a tax credit against your payroll taxes of up to $5,000 per employee, either for the wages you pay or for the healthcare benefits you pay. So for example, if you want to continue to provide healthcare benefits to employee, you can do that. You can furlough the employee. The employee could go on to unemployment insurance. And the unemployment insurance system, while the implementation, as we all know, has been really difficult in terms of standing it up in the state of Maryland, once somebody gets through, it is a vastly improved system as a result of the federal legislation, an additional $600 per week per person. And we also made many people eligible for unemployment compensation who are not previously part of the system, right? The gig workers, the part-time employees, the contractors. So they're all now eligible. And once you get in, and I know how difficult it is because we're working with constituents, that person will be able to get sort of the back pay to the date of original eligibility for that uninsured compensation. So I just wanted to mention that one option for employers is that if you don't go the PPP route, you can also, again, use this credit against payroll taxes up to $5,000. There are slightly different rules if your nonprofit has over 100 employees, and you can look into that if you're in that category. Let me just then quickly mention the assistance that's coming to the state and local jurisdictions. And I'll focus on Montgomery County since this is Montgomery County nonprofits. Montgomery County, because it has over 500,000 people, is already taken a direct draw of funds on the Department of Treasury, the U.S. Department of Treasury. And they're going to get $181 million in a stabilization fund. Now, the good news is that is a substantial amount of resources. On the other hand, there's not a huge amount of flexibility in the use of those funds. And one of the things I hope to do, and we hope to do in the next round, is to allow those funds to be used to backfill deficits, because the loss of revenue for the county and the state is a direct result of the COVID-19 outbreak. And yet that is not an allowable use of these funds. You can't simply use them to backfill deficits. You have to use them to pay for costs that you've incurred because of the COVID-19. Now, that's still a big help, but it's not as flexible as we would like to see. So that's $181 million coming to Montgomery County. In addition, the county will receive close to $3 million in CDBG grants. And we made these, they're already a flexible pot of money. We made it even more flexible. There's $2.8 million for Montgomery County for emergency homeless assistance. And the Montgomery County school system will receive $39 million. And I'm urging them to use at least some of those monies to address the homework gap and the digital divide for students who are not connected to the internet. So those are some of the major federal income streams that will be coming to the county. I want to mention food assistance very briefly. We did plus up all the major federal food assistance programs. So for example, the SNAP program, and more people are becoming eligible for that. We plussed up the child nutrition programs. These are the school lunch programs. And now, since the student's not getting the meal in school, families can come to the schools. I think there are 350 designated schools in Maryland, and get their meals. And most counties and school systems are being flexible in terms of providing the needs of more than just the student. We also plussed up the accounts under the temporary emergency food assistance program. So these are the monies that come to the food banks. We plussed that up by close to $1 billion. And so those are some major sources of additional food assistance. Now, we know, especially because of the delay in unemployment insurance, more and more people, of course, are trying to access food assistance. So this is a vital area. Let me just close by saluting the county for addressing a very pressing need that is not covered in the federal legislation. And that is for a significant part of our immigrant population, especially the undocumented, because individuals in that group are not covered by the major federal programs, whether it's unemployment insurance or PPP or any of these other programs. They can access the healthcare system through community health centers, and we were very deliberate in making sure funds went to those community health centers. And then, of course, they are eligible not for the SNAP program, but they are eligible for food assistance through the child nutrition program, the school lunch program, and through food banks. So that's an area where we need to really focus. And I know the county has taken action on its own to help fill in some of those gaps. So let me end there. Thank all of you again for what you're doing to help weather the storm and help people most in need weather the storm. And hopefully your organizations will survive as we go through this difficult time and come out and we'll be stronger on the other end.
Well, thank you. And thank you for all your advocacy on behalf of the county and the sector. Truly appreciated. A couple of questions in the Q&A box. Let's see, one is from a nonprofit daycare provider who just received a PPP loan, and they say thank you very much. They also say we have some temporary employees who we did not count in our personnel numbers. Can these people apply for PUA, and how will that affect if our loan can be forgiven? That may be too technical.
I'm sorry, can they apply for what?
It says PUA. I don't know if that's unemployment. I'm not 100% clear.
Well, let me say something.
I guess the question is, if their employees apply for unemployment, the temporary employees, does that affect their loan?
So two things. My understanding is that a part-time employee counts toward whether you're eligible within the 500, if you're under 500 people. Right. Mm-hmm. And I think they will also be counted in your payroll, whether you've achieved your pre-coronavirus payroll levels in terms of the forgiveness for the loan at the other end. But I will say one thing that I think is smart to do. You need to look at your own circumstances. Maryland is one of the states, and Senator Kagan and others have worked on this, that has a work share program, and not that many states have done it. And one of the good things about this federal legislation is we were very deliberate in making sure that we supported those efforts. So, for example, if you're an employer and you need to, lay off people because of revenue reasons, instead of laying off, if you have 10 employees, instead of laying off 5, you can put all 10 on part-time status. They then do qualify for the Maryland unemployment system under our work share unemployment provisions, and they qualify for the additional $600 a week that's coming from the federal unemployment fund. So that is definitely something, again, you should consult with, everybody, that knows the details of your organization, but that is definitely an option. This work share piece has been, I think, underutilized in many cases. So again, that is an option, and the federal legislation provides not just the $600 a week in funds for people in that status, but also is paying the states that have work share programs providing additional resources for them to help them with those programs.
Great, thank you. Another question, can a small business or a nonprofit apply and receive funds from both the first and the second phases of the Paycheck Protection Program? It's probably in.
Well, if you did not receive if your application was not accepted in round 1, you can certainly continue to apply. If you've already been accepted into the Paycheck Protection Program, no, you can't. Now, look, this does beg the question about how long this will all be with us, and whether or not there'll need to be an extension of the payroll protection program. That remains to be seen. I will say one of the design flaws in the Paycheck Protection Program that I've tried to fix from the beginning, unfortunately unsuccessfully on this count, was better aligning that 60-day period for the use of funds with when a nonprofit or a small business can expect to essentially be open for business again. So there are some challenges with PPP program, and it is really important that an organization fully understand what will be required in order to achieve forgiveness at the end of the day, and when they apply and get that program.
Absolutely. Okay, here's another question. What are the prospects for the $500 billion the National Governors Association is seeking? Is that something you're familiar with?
So, yes, look, this has to do with the need of state and local governments, which is a huge need. And really 2 things need to happen here. One is we do need additional funds. The other part is the flexibility I mentioned earlier. A lot of the states and counties that are receiving these funds, under the current guidelines, some of them may not be able to use all of the funds, even though they're experiencing big deficits because of revenue shortfalls. So we do need to increase the funds. The CARES Act round 1 provided $150 billion. We need to increase that, but we also, and really importantly, need to make the use of those funds more flexible. Now, what are the chances of an increase and when? I'm sure people may have followed the comments of the Republican leader in the Senate, Mitch McConnell, who about a week ago said that states and cities and counties should just, file for bankruptcy, which was one of the worst ideas I've heard in a very long time. It would just drag the economy into further recession. And he, in the last couple of days, has sort of walked back those comments a little bit, but he has said that in exchange for additional funding for state and local governments, he wants to do some other things that are not related. So we'll see. As you indicated there's bipartisan support. Both Governors Hogan and Cuomo, on behalf of the NGA, asked for another $500 billion. I don't know exactly what the number will be, but there will be, I believe, additional funds. And again, importantly, they need to be more flexible. And finally, as to the timing, I don't know. We're going to try and work this out. I think this next round, though, will be it will be harder to get consensus on the next round than it has been on the earlier 4 rounds.
Okay, thank you. And overall, I would say, what is your feeling, optimistic versus pessimistic, about how and when we recover from this?
Well, like all of us,
that's a hard question.
Like all of us, I rely on the healthcare experts on this, and there's a lot of uncertainty as to exactly what it means to be on the other end of this, right? Because it appears that, you know, the virus will be with us for some time. The bigger question is whether we can return to some sense of normalcy and at the same time take the necessary precautions to avoid the spread until we get a vaccine, assuming we get a vaccine. And again, you know, Dr. Fauci is, at least a few months ago, said that would be a year to 18 months. There are accelerated efforts to try to get a vaccine, but I don't think anybody can count on that. So the real issue then is, okay, once we get to the downside of the curve, how do we structure our lives and interaction in a way that prevents the virus from reigniting? Because the last thing you want is to have it come back in full force. And in order to do that, we have to, of course, observe the social distancing requirements, but we also need this much higher degree of testing and more rapid testing, because it's not enough simply to test those who are symptomatic. And, you know, it's really important that we have the ability to test people who are asymptomatic to discover early on and detect whether the virus is coming back. And we need to make sure that that's universal, but also focus it on areas that have been hardest hit, including some of the minority communities in the African-American community. And then we need this whole issue of contact, you know, tracing. So you need to be able to quickly detect the reemergence of the virus, including in asymptomatic people, and that means you need to test much more broadly. And then you need to be able to quickly identify everyone they come in contact with, and, you know, put them into you know, self-isolation and do the contact tracing. And so that is why there's such a important focus on scaling up testing so that we can do it on a much, you know, many more people, much more quickly.
Great, thank you. And any words of advice for nonprofits?
Well, again, I want to thank nonprofits. I mean, you do such a range of important things, but I think that the hope is that these programs, while implementation has been difficult, will provide, at least combined with the other things that are out there for people, like the unemployment insurance, you know, like the individual payments, like some of the other parts of this bill that taken together, you'll be able to, you know, weather the storm here. And then as some of you have to, you know, continue your good work during this period of time. So again, keep in touch with us. Our office is available. You know, we can be contacted virtually. We're up and running 24/7. So let us know if we can be of any assistance.
Great. Well, thank you again for being with us this morning. It was really great to hear right from you, and good to know that you're out there and working on our behalf. So thank you so much.
Well, thank you, and thank you all for what you're doing.
Take care. Great. Well, next up, I don't know if JoAnn Barnes was able to join the call. I don't see her here. JoAnn, are you on? JoAnn Barnes? She is on. Okay, JoAnn is going to talk to us about the Emergency Assistance for Residents program. Go ahead, JoAnn.
Okay, good morning. Thank you for having me. So we actually did launch the Emergency Assistance for Relief Payments program on Monday. We launched that program with not only a press release, but also the first batch of checks went out to some of our residents. Our first phase, and I think some of you may be aware, we selected our first phase from the caseload of our Care for Kids program because we wanted to focus on families that were low income. We couldn't serve all of the Care for Kids caseload. We did, as we will throughout this program, create a threshold based on federal poverty level. And right now we're serving families that are at 50% or below of the federal poverty level. So we did look at Care for Kids. We know that they were families that we had already verified their income, their addresses, their household size. And that's why phase one was able to be done with no action on the part of those families. So those benefits have started going out. Phase two is we are in the final stages of putting together the plan. We're going to be working very closely with the Community Foundation and a hub of nonprofits. And unfortunately, right now, I'm not able to identify who the final nonprofits will be, but we're looking at the nonprofits that we have established relationships with when we went through the recession in 2008. We're looking at nonprofits that we know have the capacity to help us with this. And we're looking at nonprofits that have a good reach in the community to be able to serve the target population for this program. So having said that, I would say the target population is definitely families who are not eligible for the state and federal programs. We really want to serve the families that fall between the cracks. And in Montgomery County, that is largely our immigrant population, but not solely our immigrant population. There are some small pockets of families and individuals who, because of unique circumstances, aren't eligible for the federal stimulus, aren't eligible for unemployment, and may still have a need. So we want to make sure that our reach is far enough to include those families as well. Some of the groups that we looked at would include homeless individuals, victims of domestic violence. I'm glad to hear that Jacob and Shané are on the call this morning because disconnected youth is another population that we want to target. So what I wanted to focus a little bit more on, and then maybe open it up for questions, is just what we think the process will look like in phase two. Our plan is to give nonprofits, what I'm going to call the hub nonprofits, a certain number of slots that they can take applications for. Because while we're dispersing the activity, we still have to monitor the funding separately. So our at a high level, the elevator level, we want to give slots to those nonprofits and have them work with families that they are already working with, or families that other nonprofits refer to them. Because even though we'll have a small hub that will actually be doing the intake and pushing those applications through for payment, they are not the only nonprofits that would have access to get an application through. It's just you would funnel it through one of the doors that we open at the hub nonprofits. So that's why over the next couple of days, it's going to be important for us to put the final touches on how that process would work and begin to get information out to other nonprofits. We also are proposing a phase 3 where we would open certain programs in HHS as entry points into the relief payment process. And those would be programs that typically are working with families like the cluster programs that are school-based, or at least based on the school clusters. We have one in Watkins Mill, one at Kennedy, and a new one at Springbrook Paint Branch in that community. And they're already working with families that they know are struggling, were struggling when the doors closed in the schools last month. Other programs would include the linkages program. We want to make sure that we have an entry point in East County. And so that will all be part of phase 3, so that families that may not have a connection directly with the nonprofits, but also have connections with or familiarity with HHS and their entry points might also be able to apply through there. My biggest concern is that our need surpasses our availability of funds. And we know that the county executive and council are working on adding additional funds to this program. But even with that being said, because of the impact on this pandemic with our families, we just expect the need to continue to grow. So having said that, I think I could stop. I could talk about this for another 30 minutes, but I think it might be more helpful if I answer questions.
Okay, and just to remind people, what we're talking about is the Emergency Assistance for Residents program, which I believe is a $5 million fund established by the council and the county executive for individual assistance for families. While I scan the question box, just wanted to ask JoAnn, will you be making a way, since there's only certain nonprofits that will be able to participate, will we be able to know who they are? So if other nonprofits have families that would be eligible or that are in great need, can refer to those nonprofits? What does that look like?
Absolutely. Okay. That's exactly what we will do. And again, the hub nonprofits, I don't ever want to classify them as the ones who are able to participate. All nonprofits will be able to participate. It's just that we're going to funnel that work through the community foundation and a hub. So, if you envision it like a wheel, we're going to put Community Foundation right in the middle, as they are excited to be our partners with this. And there are major benefits to having them as our partners. And then the initial, if I could call them the level 1 hubs, would connect right out of Community Foundation, and then all other nonprofits would then go in through those designated level 1 hub.
Okay, and what do you think is the time period that it'll take to get the actual funding out through those nonprofits, through the hub? How long is that? Just a guess.
You mean before we have the process set up, or once it's set up?
Once it's set up, like how will it be a fairly quick turnaround?
Yeah, our plan is that once an application is received from a nonprofit, that they will screen the families based on the criteria that we've set in place, and that criteria will be consistent across all levels, so and all phases. So the same criteria we applied to the families in phase 1 will be the same criteria that we apply in phases 2 and 3. In addition to that, whatever documentation is required, which is also minimal, the nonprofits would review that documentation and sign off on it as, acceptable. And then they will forward a record to HHS. HHS is committing to a 48-hour turnaround to validate that benefit. Validation means to make sure that we didn't already pay that family out of phase 1, to make sure that none of the other partners have paid out of the phase 2. So the one thing about the system that we're putting in place, very similar to the holiday giving database, you can see everything that you put in, but you can't necessarily see what the other partners have put in. So that validation will be centralized, and then depending on the method of payment that the family has selected, whether it's check or debit card or an electronic transfer, then those approved records will go immediately to whether it's a check or debit card or a transfer to the vendor that will issue those payments. And we expect that process to be ongoing. It won't happen once a month. It won't happen every 2 weeks. We think that we will accumulate some records and send them out. So once it starts, you will see the payments coming out just on an ongoing basis until we have reached all of the families that have approved applications. Now, that whole process, we're hoping the validation and getting the record to the payment point of payment will take less than 5 days. And so we were thinking that by the time it gets to that vendor and then the payment is issued out, it could be 7 to 8 days. That's our goal.
Thank you. Great. And I see Meredith has popped on. Meredith, is there a question for JoAnn?
It's not directly on what you were speaking about, but I'm wondering if wearing your HHS hat, we're getting a lot of questions about PPE requests for healthcare professionals and also for childcare responders. And I wonder if you have any resources to share for those questions coming in.
I do not. I'm sorry, I was caught off guard by that. What I will say for my childcare providers, though, if you are funneling your requests through Jennifer Arnaiz at the Resource and Referral Center, we are working closely with the emergency operations team to make sure that we can get supplies for those centers that are open during essential childcare. So there is a methodology to help you with that. But no, I'm sorry, I'm not prepared. I certainly will take that down as something to get information back to Leslie.
Great.
Thank you.
Okay. Thanks so much, JoAnn. And I thank you for being here. We do have to move on with the agenda, but also wanted to point out that there is that request form for PPE that goes through DHHS. We put that in our last e-news, and we'll send that out again after the meeting so people can see that. Again, thanks JoAnn, and we look forward to hearing how the program evolves. And we also are getting a couple of questions from nonprofits serving other populations that are interested in making sure that their folks get access to these funds. So I think having a way to refer to the nonprofits that will have the funds, again, will be super important. Great, thank you. So moving along, I know many of you have had questions about the public health emergency grants, and we do have Jerome Fletcher here to give us the latest update on the public health emergency grants. Go ahead, Jerome.
Hi, good morning, everyone, and thank you, Leslie, for having me. Glad to be here. I want to thank everyone. Again, as was said earlier, the nonprofit community is so important to the county and what you provide that we cannot do it without you, nor can we recover without you. So I hope people are thinking in that vein of what can we be doing next as we're starting to talk about recovery, et cetera, et cetera. But as far as it relates to the Public Health Emergency Grant Program, I believe a lot of you know our grant application was on our PHEG website, on our Montgomery County website. If you were to go back to that homepage right now at this minute, you are going to see a dashboard that was launched this morning. It actually contains information regarding the grant program, such as applications. I'm going to pull it up. I wish I could share my screen. Can I share my screen? Hold on, I'm going to try to share my screen if that's okay. Oh no, that's not the right one. Hold on.
Okay. I'm not sure if you can, but give it a shot.
Yeah, where is it? I don't.
If you can't see it in the bottom bar, then you probably can't.
Yeah, I don't see the internet there. But either way,
okay.
I'm sorry. I tried to share it. My apologies. If you go to that website right now, you would be able to see some data and information on what our program has done so far. When we stopped collecting applications on this past Saturday, April 25th, we were almost at 7,000 applications. We've approved 356 awards. We have deposited money into a lot of those awardees' accounts, And we are moving forward with getting that first tranche in the first phase, which is $10 million out to the public. Our goal, if you recall, was to, oh, there we go. Hey, I did it. No, I didn't. That is really not my screen. Someone else did it. But if you see and you look on here, this is a lot of good information, as you can see from the progress of the program. Anyone who knows the program, it was not smooth and easy, and nor will I pretend it to be. But we did have our usual share of challenges. But I will say that we all persisted because I believe that everyone recognized the value of what was needed in order to give our business, our for-profit and nonprofit business community, what they needed in this time of need. So my hat's off to everyone who was able to get this up and running and get the program administered, especially our finance department, especially under the guidance of County Executive Mark Elrick. So some things that you want to be aware of is that we are currently sending out award letters for those who have made it through the process and have been given disbursements up to that first $10,000 amount. We are also sending out denial letters based on those who did not meet the qualifications or lack documentation. We have staff who have gone back to them to make sure that we could try to get what we needed to ensure that they truly did or did not actually meet the qualifications. We were very slow to issue denials, but very quick, what I would say, is to try to process those who had been approved. So now that we are in the closed application process phase, we have a few more decisions to make. We are working with council to figure out what does the phase 2 of this program look like. And I'll just tell you what I know as of today, because that's how I am. So as of right now, I'm hearing back, from our multiple interested stakeholders that, sure, it was great to issue 1,000 and take care of that first 1,000, but when you see a number up there of almost 7,000, that leaves a lot of people who will not receive any funding. If you recall, this program was set up so that the upper threshold of the funding was 75,000. Doing some quick math on how much was allocated for the program, you would realize that you would be funding less than 300 businesses if, in actuality, all of them qualify for the upper threshold. So, hindsight is always 20/20, and what I don't want and what I encourage people not to do is to blame anyone for it not being quote unquote perfect or the way that anyone would like. As I tell people every day, there's enough blame to go around for everybody, to all of us. Let's just figure it out, do better, and move on. But one of the things that is being contemplated is, well, instead of going up to the 75% threshold, on the $75,000 threshold, why not just extend out the $10,000 payment so you can have a bigger impact on more businesses? Because 85% of the businesses who have applied for the program have less than 10 employees. So we are talking about a smaller number of organizations that are reaching out to us for this support. So that is a decision that is well above my head. But I am happy to say that I'm in the middle of it and glad to be there, sometimes more than others, but happy to be there to make sure that we try to get to a place where we can actually have a greater impact on the county, because that's what we all agree with. Sometimes we can disagree on how to get there, but the agreement, which I'm glad that the county executive and the county council has, is that there's a need out there. And the more you can help who are in need, the stronger the county becomes faster. And again, back to my original point, I want to make sure that we all understand that in order to get us back on our feet, while the county is helping now, we're all going to have to be involved in some very serious and deep strategy conversations on how we can all get back to where we are going to be. I hesitate to call it a new back to normalcy, because if you recall, there was a lot of people who had certain concerns and challenges with what normal used to look like. So why would we go back in that same direction if we have an opportunity to start over and do some things differently now to make it better? Whether we're talking about business support for based on gender, race, all sorts of status, that we could actually take a stand now and say, wait a minute, let's make sure that if we do have to hit the reset button, that we do it in a way that is very, very strategic and thoughtful and has the best interests of the county overall in its ideas and what we implement through the county. So I'll stop there. I'm pretty sure there are some questions regarding the program. I'm happy to answer them. I'm happy that the dashboard is out there. One thing that you don't see with the dashboard that I've been working with our comms team this morning is the first question that people are going to ask is, where is the list of applicants who were awarded and how much did you give to those who you awarded? And that's part of our Data Montgomery, our open government piece, where we're trying to make sure that that information is out there, because just like the other programs, whether it was a state program or federal programs, the awardees during this program will be scrubbed and scrutinized, and we have to be prepared for that. And that's just a part of being a public entity. You know, when you are transparent, as we should be, people are going to have concerns about, well, why did this person get this and why maybe I did not get this? And so we want to make sure that we are being open and giving all the information to the public as much as possible, answering questions as much as possible, and not trying to hide and just be held accountable for what we put in place and answer those questions. So I'll stop there, Leslie.
That's good to hear. And we all know you've been all working night and day to roll this thing out. So appreciation there. And for all the webinars and the communication, I think that's been helpful to people. One question has to do with some inconsistency about whether or not in the first round you would consider April losses as well as March. And, you know, it's been said sometimes, no, not looking at April at all. And other people have said, well, maybe we should throw in April. So what's the status in round one? And then will that be something different going forward?
So for round one, what our messaging was, as well as we can tell, is that we messaged publicly that we were not taking information from April, because the language of the law says a demonstrated loss. And most financial statements are produced on a monthly basis. It's very infrequent that we receive financial statements on a bi-weekly or weekly basis. So for the majority of the applicants, the demonstrated loss ended at March 31st. We also recognize the fact that the beginning of the main point of loss began on March 16th, not really the beginning of the month, but when the governor closed down businesses for good, and that was on March 16th to March 31st. So you're talking about half a month. So what we've done and what we are proposed back to council is a tweak in the calculation that allows for the hardest amount of the month to be examined for those who need it to reflect their losses, as opposed to an entire month of March, where they could have had some beginning revenues in the first half of the month, which kind of did not show their true loss for the entire month. What we were, based on our guidance from legal, we were trying to get to that definite period of when the loss occurred. Now, as far as April goes, and that's just for March, as far as April goes, we are still considering how to get an April loss involved in the calculation. The problem is we didn't receive a lot of April information from many of the applicants. So we have to go back to the applicants to get from them, who we've already analyzed, what was their April loss. And I don't know if council is, I don't know if the county executive included is going to do that process, or it's possible they could reopen the process. I mean, there's a couple of things on the table as far as what phase 2 could look like. But, you know, the goal of it is now should be, we were attempting to reach the people who got impacted first in March, and that's why the program was designed. Now we're sitting here at the end of April. We've got to figure out a way to expand that reach so that those who experienced, and I think a lot of people started to feel the crunch in the month of April after it closed, you know, in the middle of March. So we're still trying to figure out how to get April in there. The executive has said that he believes that April could have been a part of our original calculation, but when you have the word demonstrated, which we all agreed to at the time, there is no blame here on that word demonstrated being in there, let me be clear. But when you have demonstrated loss into the bill, it means that you cannot project any losses. And when you started talking about projections, normally that meant the month of April.
Okay, just one last question, because we do have to move on in the agenda. But someone is asking, if you have not received an approval, should you assume that you were denied in phase 1?
No, not yet. We have, okay. Right, because what we have done recently is we've added 22 more staff to process reviews as of this week. With the 7,000 that we got in, The reason why our processing has been a little bit slower than we thought, and we had to add more staff, is due to the quality of the applications. I was told this morning there's 700 applications, and that number you'll see that did not include any documentation. Now, we all know that no documentation is not going to get you very far, and we don't know the reasoning behind them not having any documentation. But again, if we're going to find out, that takes follow-up time, which takes more time, but we still want to keep moving through the applications that were submitted properly so that those people are not penalized as well. So if you have not received any information right now, I would say please just continue to be patient. There are a lot of applications in there. Council, again, I just read another email during this webinar where they clearly emphasize that they would like to help more businesses as opposed to fewer businesses. So we all get it, they get it, and help is on the way, but patience has to be there this time. I just apologize.
Oh, not at all. I mean, thank you so much for being on, and I think we can make you a regular panelist. Maybe you can come back and give us another update next week, but we do appreciate all your efforts.
Anytime, ma'am, anytime.
You know, I hope you saved the playbook on how you did this. Let's hope we never need it again, right?
Amen. Yes, ma'am. I totally believe that.
Yes, thank you. Okay, thanks, Jerome. Okay, next up, we would like to welcome Maryland State Senator Cheryl Kagan, well known to many of you as a real nonprofit fan and advocate. Welcome, Senator Kagan.
Thank you so much, Leslie, and thanks to all of you for taking time of what I know are your busy days as demand is increasing for many of you and revenues are drying up and all those challenges. I have a lot of things that I'm going to try to cover, and yet I know that our time is short. So first off, this year I introduce at least one nonprofit bill each year in the Senate. And this year I'm just going to make very short shrift because it's not COVID related, but we launched a process to create a common app in the same way that kids applying to college do. 80% of Maryland nonprofits get grants or contracts with more than one agencies, but usually you've got to fill out different forms and different reports for each agency. We worked with a lot of cabinet secretaries and departments as well as the governor's grants office, and we're able to unanimously pass a process to start working on a common app for the state of Maryland in the same way that Illinois has and has realized tens of millions of dollars in savings for the state agencies as well as for the nonprofits. So look for more information about that down the road and feel free to be in touch. Nimble is something that some of you know a lot about and some of you don't. So I'm gonna, in this link here, I will make sure that I send the URL. So Nimble is the nonprofit interest-free micro bridge loan. There's no E at the end. It's run by the Department of Commerce and it's legislation that I passed a few years ago to allow nonprofits who have a confirmed grant or contract with federal, state, county, or municipal governments, not we're expecting money from this foundation or our gala's coming up. Obviously, both of those are kind of changed now. But if you are getting government money and there's a delay, you can get up to $25,000 interest-free, low bar to entry, and it's a revolving loan fund. Want to make sure that that can help you while cash flow is such a challenge. And that has worked very well for a lot of Montgomery County nonprofits. So again, I'll put the link on that. There is a website on the Department of Commerce. It's also, I think, on my page, cherylkagan.org. I can also tweet that out. I have a nonprofit advisory group. I also send special emails to nonprofits. A lot of you may already get mine. If you don't and would like to, please make sure you send me an email or a note. Through my nonprofit advisory group, through a meeting recently, and through a Senate Democratic caucus, I learned about the inequity in unemployment insurance treatments. And today I just sent a letter to the governor. 4 of my Senate colleagues signed on my letter and basically asking him to treat nonprofits and county and municipal governments in the same way that our small businesses are. So right now, for those of you who are reimbursers of nonprofit, of unemployment, you have to come up with the money right away, or with, and it's a quick turnaround, and cash flow, again, may be a challenge. So not for-profit small businesses were given a waiver and a delay of a year. And we want that same sort of treatment for our nonprofits and for our local governments. So we're hopeful about that. In addition to sending that out, Maryland Municipal League, Maryland Nonprofits, and the Maryland Association of Counties are going to be pushing that out and supporting that efforts. I believe you can find it hopefully later today on Maryland Matters, that blog, which is a great way. If you're not familiar with Maryland Matters, that's a great way of staying connected with what's going on at the state and local level. So I can, the last thing I just want to reference, many of you, especially those of you who are involved in social service, which I know is not all of you, but I just want to remind you of the urgency, and I know you all know this, but we just all need to keep saying it, the urgency of making sure we get to our hard to reach people and make sure that they are completing the census. The money at the back end is significant, and we are still in the 60-something%. In the past, we've been at in the 80-something%. So we really have a gap, and wouldn't it be great if we could get, you know, as close as possible to 100% for funding and for our fair share of representation. So there's a lot more, but I think I'll pause and take any questions about what's going on at the state level. I will say that Governor Hogan and his cabinet has been mostly pretty collaborative with legislators, and I think his leadership and our leadership together has worked very thoughtfully for the state of Maryland. So you can be proud at the state level that I think that some prudent decisions and prudent legislation has been enacted, including my telehealth bill, which was the very first policy bill that the governor enacted. So those of you who are working in healthcare are finding more flexible options to keep people safe at home and still able to reach their healthcare provider. And with that, Leslie, I'll pause and happy to take any questions.
Okay, let's see. We have one here. Can an organization that's waiting for funding from federal, state, or local government, so any of the other funds that we've been talking about, can they apply to NIMBLE as long as the funding has been confirmed?
Absolutely.
So okay.
That's exactly the niche. You can get up to $25,000 up to, if it's been confirmed, you've got to be able to show that it's coming. And sometimes they're delayed. And so you still need to make payroll and try to continue your program. So absolutely check out NIMBLE. And again, I'll make sure that we share that on this call and afterwards.
Yeah, we put it in the chat if people want to look at the information there.
Thank
Yeah,
you,
and actually, many of the questions relate to some of the previous segments. So if there's anything else you'd like to offer before we move on.
I think we're good. Thank you for all you do. I look forward to continuing to be your advocate and your voice. I can tell you that last year there was a bipartisan senatorial small business caucus that was established, and it's a really thoughtful group of us that works together on a number of priorities. And I can tell you that every time after we talk small business, I always pipe in and say, and nonprofits. And we've been able to really make sure that nonprofits are present in our legislative priorities and in letters to the governor and press outreach and all that. So I've got your back. Please let me know what I should know. Don't hesitate to reach out to me. And thank you for all you're doing.
Thank you so much. That's really, really encouraging to hear. And yeah, we know you're with us. So thank you.
Leslie.
Hope to speak to you again on one of our calls.
Great.
Great. Okay, thank you. And so next we're going to do a quick update on some of the funding sources with Franca. Brilliant. Franca is working with Nonprofit Montgomery as a consultant. We have stood up some individual assistance through some funding that came from the county, so people can go on our website and request appointments with Franca and a couple other consultants that we've lined up to help you file those applications. So go ahead, Franca.
I guess I should say good afternoon, everybody, right? We just crossed noon. Anyway, good afternoon, everybody. This has been an incredibly informative webinar. So congratulations to Nonprofit Montgomery for a really outstanding lineup. So a lot of the things that I would normally cover have been covered. I'll just briefly mention some of them. the EARP, which is the funding to individuals, it's great news that the county has gotten that out. And you heard a lot about that from JoAnn. You got a summary of where we are with the PHEG, as I call it, which is the Public Health Emergency Grant from the county. One thing I thought was really interesting, on the dashboard, it looks like only the applications, only 6% of them came from nonprofits. So that's something to look at. I think if there is another round, I would encourage more of you to apply. You don't want to leave money on the table. And hopefully the county will be able to, find funding for that, perhaps through some of the federal money that's coming through. There's been a lot of chat in the chat box about personal protective equipment. I wanted to just add a couple of things. One is that the Montgomery County Economic Development Corporation has a $200,000 grant fund. It's open until May 1st, and that is for people who, organizations that can produce PPE, and nonprofits can be eligible for that. You have to have a track record of producing that kind of equipment or something similar enough, and you have to have a marketing mechanism and so on. But just something to take a look at if you're set up to do that. And the governor has just announced the grants at the state level for producing that kind of equipment, and a local business, Rankin Upholstery, was one of the recipients. So take a look at that. And we've also, I think, talked about the fact that we can request PPE equipment directly from the county, and I know there's been a lot in the chat box about that. Some other updates quickly. I think Senator Van Hollen touched on this a little bit, which is there is another round of the federal funding, both the Paycheck Protection Program, so another $310 billion for that. Some of the changes that they've made, setting aside the $60 billion to smaller lending institutions with the hope that it will get closer to the community. There have been a number of reports, I'm sure you've all seen them, about public companies that have borrowed money. The Secretary of Treasury actually made a statement that anyone who borrowed or could be forgiven for more than $2 million would be audited, and companies have until, I believe, May 7th to return it. And at this point, I think I had a number somewhere like $160 million has come back into the program. So for those of you who are interested, the demand has been huge. The system crashed again, but I would just say, put the application in, as soon as possible if you haven't already, because there is more money coming into the system, both through the appropriation and through this return of funding. In addition, the federal government increased the amount going to what are called EIDL loans, basically disaster loans coming through the SBA as well. And there's a $10,000 advance on those. It's capped at $10,000. So basically, because again, so much demand from nonprofits and businesses, if you have, it's turning out to be basically $1,000 per employee up to $10,000. So if you have 3 employees working for you, you could get a $3,000 advance on those loans, and that advance is essentially a grant. You are not expected to pay it back, whether or not you take the loan. So that's another thing for people to look at. A couple of other things. One, the Health Commission at the state level has just put out an RFP for health providers, and they've defined that pretty broadly. You can be a community health resource. You don't have to be a direct provider. It's up to $50,000. The application is open, I believe, until the 14th of May, and I'm sure Nonprofit Montgomery put the information out in the mailer. I'm sure they'll put the link in the chat box. But that is definitely something to take a look at. And just a word, that is specifically not for salary or for revenue loss to reductions in service. It is specifically for things relating to support provided during this period relating to the COVID emergency. One other thing I did want to mention is that I'm focusing on the grants because that's where, and the federal funding, state funding, local funding, that's where the big money has been. But there is also an individual donor opportunity where we're still in the midst of this first wave of giving that happens after a disaster, and people are responding. According to at least one survey I saw, lots of individual giving, more individual giving at a lower level. And Giving Tuesday is May 5th. So last year, Giving Tuesday raised $511 million in the US online. Basically, it's just a focal point. Usually it's in December, but the Giving Tuesday people agreed to move it up this year to give an opportunity for nonprofits to raise funding around it. So take a look at that. It's called Giving Tuesday. There are lots of resources on the web. And even if you can only get out a few emails to point people to that as a giving day, it's worth doing. I think I'll stop there. I know you've got a lot of people to come, and happy to take questions in the chat box.
Great, thank you, Franca. And again, people can go on our website and request individual appointments. Also to point out that Thursday and Friday, we're offering some free programming. One is chat with a very experienced development consultant who's going to talk about development and strategies going forward. And we're also having a webinar with a couple of employment attorneys around unemployment and issues people need to be aware of. So I really encourage you to go to our website and sign up for those if you have questions about either of those things. And finally, we really wanted to make sure that we included some sector updates in these conversations to really get a sense of what's going on in the world with the nonprofits that are on the front line. So I'm really pleased to welcome Jacob Newman from LAYC and Shané Tate from the Collaboration Council to talk to us about what's going on with youth, what they're seeing, how they're trying to connect disconnected youth with services and opportunities during this difficult time. I'll turn it over to both of you. Thank you for being here.
Thank you, Leslie.
Thank you, Leslie. Shané, the floor is yours.
Thanks. So at the Collaboration Council, we're very pleased to serve as the local management board here in the county, helping to broker public and private partnerships and investments on behalf of children, youth, and families. So a lot of the work that we do touch those service providers that are here participating on this call. So thank you all for the work that you're doing, and we're looking forward to partnering. Currently, one of the ways that we're helping to serve are through our Excel Beyond the Bell resources. I know that some of our Excel Beyond the Bell contractors and providers are on this call. And what's happened is that, they've had to kind of be nimble and respond to a very urgent need of getting young people enrichment resources in partnership with our school district. We've seen the school district respond very quickly with resources for academic learning and academic development, but call for a need for providers that were working in the out of school time space, the after school space, the youth development space, to develop other resources so that young people could be supported social emotionally in a well-rounded way. And we've seen providers through EBB really mobilize and answer that call with digital resources that can be accessed both offline for them to do with their families in their homes, as well as online, because we know that there's an equity issue around the digital divide. And we've seen about 65% of the programs that we fund for EBB middle school respond to that. And there is definitely room for more organizations to respond and support that effort. But we've seen that they haven't had necessarily the tools or the expertise or the training. So we're helping to support that as well through our youth development community of practice, offering more online webinars for people to kind of ramp up their knowledge on remote learning techniques, distance learning, and digital, creating digital learning opportunities for youth and developmental opportunities. Our programs that are supporting disconnected youth are really looking at individually meeting some of the needs that some of their families and participants have presented, doing individual outreach and making sure that we are being nimble in how we're funding and allowing for the scopes of the programs that we're funding to wrap around the current needs. So we've been really responsive with the support of HHS. Thank you, Vicki Butlin, for the initial announcement that providers should seek different ways to continue providing resources and services to the families that they're serving in the midst of this crisis, because it's been really helpful for people to think outside of the box and continue to connect with the families that they were originally serving before this crisis as new needs have arisen. One of the challenges that we're seeing is in this response, we're still seeing that organizations have had to lay off staff, had to furlough staff, are cutting back on hours, and that is impacting our frontline workers. So coming out of this, we're really thinking about what the organizational landscape will look like for some of our providers that are currently working in our programs, and how do they sustain to meet what we know will be new needs coming out of this for our youth. So we're really hopeful that some of the programs on the federal, state, and local level will help, stave off some of that, but we're expecting that there are going to be some deep cuts to some of the services that we had before. And that, for me, leads to a need for our larger community to continue to advocate for those investments to be protected and often increased in different areas. We know that we're going to be called upon to provide different services. Just looking at some of the trends across the country, that school districts are now thinking about blended learning opportunities. What does that mean for nonprofits that are serving in the youth development space and their operating costs? And how might funding need to be restructured to allow for them to grow in those areas is really on our mind at the Collaboration Council. So those are some of the questions and some of the areas that we're continuing to make sure that we're supporting providers and connecting with families and providing opportunities to young people even during this time. And if there are providers that have digital resources or opportunities that they would like to utilize some of our platforms to promote, we're definitely open to pushing that information out through our site, informmontgomery.org. We also have the excelbeyondthebell.org website, where we currently are housing some digital resources for families, and primarily focusing on middle school resources currently, but we are open to hosting resources for elementary parents and guardians and families, and also families that are working with students with intensive needs or disabilities or abilities that aren't typically addressed in general education programs. So we are open to supporting however providers are needing to be supported through professional development, or even through reaching families by using our platforms to push out what nonprofits are doing.
Great, thank you. It's really great to hear that you're helping providers figure out how to serve people virtually. So that's and thanks for all the support that you're giving. Jacob, what does it look like at LAYC?
Sure. Well, good afternoon, everyone, and thank you for the opportunity to provide a brief update in terms of what many of our youth and families have experienced over the past several weeks, and a short summary of LAYC's response. It's exciting that still so many people are on the call here. Latin American Youth Center serves over 5,000 youth and families each year across Washington, D.C., Montgomery, and Prince George's counties. And we support all communities, not just Latinos, through multicultural, comprehensive, and innovative programs. In Montgomery County, while we do serve young children through school-based programs, our work is primarily centered around education, workforce development, mentoring, and wraparound social and emotional supports for older opportunity youth, those who are ages 16 to 24, otherwise not working or in school, and oftentimes most at the margins. In many ways, we do function like a school, and in others like an extended family, a network of supportive peers and adults for a group that's often forgotten or slips through the cracks. And, before going any further and talking about what we've been doing, I want to acknowledge that just as in pre-COVID times, this community of young people continues to demonstrate incredible resiliency. So beginning March 16th in Montgomery County, we began launching virtual programs and remote supports. And from the kind of school lens, if you will, our work has included bringing 3 GED programs and workforce development programs online, creating that content, figuring out the delivery so that students could be a bit self-guided and self-paced if their schedules didn't permit, and then also have that live learning and connectivity elements. And we've certainly been adapting since. Challenges that our communities have faced certainly are access to technology, limited physical space in homes to participate. Folks often feel on top of each other. Learning environments which are contrary to the learning needs. And so we're hosting job readiness training workshops, navigating internship and certification opportunities, just to keep youth engaged and really prepare them for what comes next as well. I think in the second week, about March 23rd or 24th, a frustrated Conservation Corps member captured the sentiments of many of her peers, and it still sticks out with me. She said, "I loved being in the classroom with Miss Carla and then working in the parks with MJ and Justin. This isn't what I signed up for." And that really hit hard. You know, we know what a lot of students are going through, whether it be in public schools or in alternative education programs like ours. It's not what they have signed up for or are prepared for. And so we know that if we wanted to, if we wanted youth to show up and remain engaged, we had to preserve what is at the heart of what we truly do, and that is build community. And so since those early weeks, we've ramped up our creativity, added social hours, played games, provided space for youth to just come as they are, and it's extended into the one-on-one work with each participant as well. That is, of course, the basis of our intensive case management. And so through that lens, we've been staying in close contact with all clients, and then additionally have made an effort to conduct outreach to about 500 youth who have been in program over the past 2 years, just to assess their needs and see where they are. I would say also through this time, we've had a greater connectivity with family members. Sometimes the family members of our older youth are not as involved, but that has increased through this time. So like many of the weekly calls thus far have addressed, and some of the comments today, the primary needs that are presenting include income and working, housing, food, mental health, and wellness. And so everything is just seemingly compounded and more intense throughout this time, as you can imagine. A job which was barely making ends meet before has been lost. A tenuous relationship at home has erupted because there is that constant interaction. And feelings of loss and despair are quite amplified because, truthfully, that's the message that's all around us, I think. It's the network on this call here, or Zoom meeting, that's really been supporting us, government, nonprofit, and for-profit business partners, and the myriad of needs that we've experienced over the past several weeks. And I'd like to acknowledge that our staff have been amazing in adapting to roles that they did not sign up for as well, in juggling their own personal challenges. I think it's something which, thankfully there's recognition within this nonprofit community, but often goes unsaid. While there are many thanks due, I do want to appreciate colleagues at the state, Senator Kagan and the Governor's Office of Children, the Collaboration Council, DHHS, and two particular providers, Man of Food and Every Mind, who have just been incredibly supportive. So thank you for your steadfast leadership. And also appreciate, colleagues in the youth services space, Community Bridges, YMCA, Identity. It's been an opportunity for us to, just hop on the phone and talk to each other to think about what are the best practices of now and how we will integrate or reintegrate moving forward. To give a quick 30 seconds about LAYC, kind of the broad update across all 3 jurisdictions. We've worked to raise private dollars to provide groceries, diapers, supplies, rental assistance for many of our undocumented families and those, as mentioned before, who are not qualifying for other funding or have a barrier to access other funding. Our housing team continues to provide safe living environments for foster care and runaway and homeless youth. Our Prince George's County team has partnered with World Central Kitchen to distribute 500 meals to residents each Friday, beginning last Friday, and for as long as this is going to last. And, across each jurisdiction, we've really worked hard to ensure that counseling and mental health supports are available to all clients. For us, it's about balance. I think that, we're trying to strike this balance between crisis management and some preservation of stability. And so in closing, I just want to recognize that there are many other providers who are in this space with us and offer up an opportunity to hop on a follow-up call and maybe dive into the weeds a little bit more in terms of what others are experiencing as well. Thank you.
Great, thank you, Jacob and Shané, for the great work that you're doing. And Jacob, I'm listening to your comments and thinking, it's great that you've all been able to pivot, and also at the Collaboration Council to support the people who are providing the services directly to young people and families. And I keep thinking about also the strong relationships between nonprofits and how those are helpful at this time, because you know each other, you work together. And, I do agree, Jacob, there's probably a lot of opportunity for, meeting as sectors and trying to figure out how do we bridge these gaps. A couple of questions in the Q&A have to do with college-age youth. One having to do with low-income students at college who may have gotten there but are now home, and how can they be connected with any supports? These are people who may not have family supports, may not have income because they have been in college. And is anyone seeing a return of the college students to their programs?
I'm happy to answer.
Go ahead, yeah, please.
Yeah, I would say that not in the moment, as we've really structured the preservation of our GED programs as the basis, but as we are rolling out more of the workforce development components, internships, certifications, we are anticipating that. In fact, in DC, I have the privilege of overseeing a green infrastructure job training program, and we anticipate some shift in terms of the applicants the longer this goes on, being some of those who are returning from college, but still want to remain engaged and productive in learning and growing.
Yeah, I agree. And then there may be also a whole group of high school seniors who decide to defer college because this is going on. And, how do we put them to work and engage them in all the things that the community is going to need? So that's a big challenge. Shané, is there anything else you'd like to add? Unmute. There you go.
Yes, if there were organizations that were thinking about ways that Collaboration Council could support their efforts during this time, either through our youth development community of practice, they can absolutely reach out to me. I shared my email address. And also we're gonna be doing some community convenings as a part of our community needs assessment starting May 20th, focusing on youth serving providers about what are those needs and trends that we've seen in the past, and also discussions about what we expect will be impacting some of the needs that we had seen in the past, exacerbating them now since COVID-19 has taken place in our county. So look forward to those invitations in your email inboxes, and we hope to convene with you and hear more about what your organizations are seeing.
Great, thank you. Definitely everyone connect with the Collaboration Council, and don't forget about what a great resource Info Montgomery is, particularly at this time. Well, thank you both for being here. I feel a little comforted by hearing the work that you're doing and knowing that you're out there and supporting youth and families. So thanks for being here today. We did have to defer our discussion with the developmental disabilities community because of the full agenda this week, but we are bringing that back next week, and we'll be featuring a couple of different nonprofits talking about how they're meeting the needs of those that are developmentally disabled at this time. And so we look forward to that next week. Again, thank you everybody for joining Nonprofit Montgomery's weekly Zoom meeting. This is week 7. We'll keep doing it as long as we need to. But do check out some of our programming again on fundraising and on what you might need to know from an employment lawyer. And here we go. We have upcoming programming popping up on your screen right now. Check out our COVID emergency page and connect to all of our resources then. And again, thank you everyone for being here on the call today, both of you, for you listening in, for our speakers. It was great to hear from everybody. Let us know what else you want to hear, who else you want to hear from, and do stay connected. We'll get through this together. So thank you everybody.